And thanks for staying with us at Midday. We are taking your questions now for veterinarian Ryan Steen. 365-9999 is the number to call. Let's get right to the puppy that you brought in with you today. He is adorable.
He is. This is, he doesn't have a name yet, but he's 3 months old, a little lab terrier mix, and he's at Cedar Rapids Animal Control. He was a stray, and so he'll be able to go to a new home at the end of the day today.
He is adorable. And based on his paw size, I'm going to guess that he won't get as big as like a traditional black lab.
Definitely not. Nope. He's going to be a little smaller, so he should be a nice size for somebody.
Adorable. Let's talk a little bit about something that's kind of a tough topic for pet owners, cancer, because it can affect our pets just like it can affect us. When do you know that you need to go into your vet and have it checked out?
Yeah, cancer is it can be difficult to diagnose because it doesn't always show up the same way. I mean, it depends on the type of cancer and where it's at and that kind of thing. Certainly, if you see your pet have a diminished appetite, weight loss, lethargy, changes in thirst, that kind of a thing. Those are just general things, and just because you see a change in those certainly doesn't mean your pet has cancer.
Sure.
But it's a indication that you should have your pet evaluated. One of the tough things about cancer is that it doesn't always show up on blood work. I mean, that's typically where we'll start to try to do a blood work and urinalysis to try to evaluate the overall health of the pet. But sometimes those can be normal and you could still have an issue, and so sometimes that leads to advanced imaging.
Okay, and you also wanted to mention some advancements that you've made, even with chemotherapy, because you hear about chemotherapy, radiation for cancer patients.
It's amazing what options there are now.
Yeah.
I mean, it used to be, certainly that cancer in a pet was essentially a death sentence, and it's certainly not that way anymore. There's a lot of things that we can do, in regards to radiation or chemotherapy. There's advanced imaging available at Iowa State University and elsewhere with like MRI to find some of these issues and get a better grasp of what we're up against. And there's veterinary specialists, veterinary oncologists, and that can help, design a chemotherapy protocol that extends the lives of pets.
It's good to know that there's hope for that. Joanne's on the line with a question. Go ahead, Joanne.
Hi, I wanted to know what you thought about ACL tears in dogs. I've had a golden retriever that had to have TPLO surgery, and now I've got a Sheltie that had an ACL, conservative versus surgery. He's 12 years old.
Yeah. I think each ACL injuries or anterior cruciate ligament injuries are actually remarkably common in veterinary medicine. There's a ton of dogs that have ACL injuries. I do, on average, about 110 ACL surgeries per year.
Wow.
And there's certainly other veterinarians that do them as well, so there's a lot of them out there. It often comes down to the individual. You kind of got to weigh the risks versus the benefits. On an older dog that's smaller, you might lean a little bit more towards conservative management. A younger dog or large breed dog, that surgery is almost always the best option.
Sure.
And there's several different surgery options that are available. She mentioned TPLO. There's a very similar surgery called TTA. They're pretty advanced surgeries, but they can make a huge difference for these guys.
Improve the lifetime of your dog.
That's
for
exactly
sure.
right.
Well, if you're interested in adopting this adorable puppy, by the way, yet to be named, available at Cedar Rapids Animal Care and Control at the end of the day. So give them a call if you're interested. He certainly is an adorable little guy. And Dr. Steen, you're not so bad yourself. Thanks for coming in today. And coming up tomorrow, our financial expert will be here to talk about 6 factors that determine your net worth. Stay with us.